Welcome everyone to this evening's Fertility Network UK webinar on andrology services at the Wales Fertility Institute. My name is Bethan, my pronouns are she, her, and I work for Fertility Network UK. I'm absolutely delighted to be joined by two WFI staff members, Sophie Hayward, Trainee Clinical Andrologist, and Sarah Evans, their Andrology Laboratory Manager and a Senior Clinical Embryologist. Sophie and Sarah will talk us through an overview of how service users can prepare for a diagnostic semen analysis and what to expect when attending their appointment. They'll follow that by a review of the parameters covered in the diagnostic semen analysis, how to interpret results following a discussion with your clinician, and what the results may mean going forward. And finally, they'll cover the next steps after analysis and what that pathway might look like. For reassurance, we're only recording the speakers. You'll be able to watch it back on your YouTube afterwards. If anyone has any questions for Sarah or Sophie, please pop them in the Q&A and I'll get through as many as I can before the end. So without further ado, welcome Sarah and Sophie, and over to you.
Lovely, thank you. Hello, everybody. I'd just like to say thank you to Bethan for inviting us this evening. I'm Sarah and I'm here with my colleague Sophie, and we're going to be talking to you about the semen analysis pathway at the Wales Fertility Institute to give us service users a better understanding of what to expect from the process and hopefully make it a little bit easier. So we'll go through how to prepare for a semen analysis, including referral and booking an appointment, what the semen analysis covers and how to interpret the results, and finally what the next steps might be. So a brief review of the Wales Fertility Institute, which has seen considerable changes over the last few years. We offer NHS and self-funded fertility treatment and have 3 sites. The first is based in Newport Talbot Hospital, where we undertake a full range of IVF treatments. And our 2 other sites are andrology sites, Singleton, where we undertake diagnostic andrology, and finally the University Hospital of Wales in Cardiff, where we undertake diagnostic andrology and sperm freezing for fertility preservation. Andrology services are provided to those coming under Swansea Bay, Cardiff and Vale and Cwmtaf University Health Boards. Our andrology labs are ISO accredited and they providing full confidence in the quality of our results. We achieve this using robust processes to verify our results, ensuring impartiality and competence. So when do we do a semen analysis? We do it when we're doing investigations for individuals and couples trying to conceive, those who have undergone chemotherapy, surgery or treatment which may have impacted their fertility, or those wishing to donate sperm. So for any of these groups, the first step is going to be seeing a clinician. And this may be your GP or a specialist such as a gynecologist. And once you've seen the clinician and they feel that a semen analysis is appropriate, they will then say that they want to have a semen analysis undertaken. So there are 4 steps for this. The first one being the referral that they're going to provide for you. The booking of the appointment, the attending the appointment, and then the results and what they will then mean. So, as mentioned, it may be your GP or a specialist doctor who refers you for your semen analysis. However, regardless of who refers you, the process is the same. So when you are referred, you'll be given a request pack, and this pack will have a semen analysis request form, which we can see here, and a pre-weighed sample collection pot. If you're self-funding your analysis, so it's not that you've been to your GP or a specialist doctor has requested that you just want to have an analysis done, you can contact us directly and we'll arrange for the referral pack to be sent directly to you, but otherwise it will be given to you in your consultation. It's really important that the pot that comes as part of the referral pack is the one you produce your sample into, and there's 2 main reasons for this. The first one is that we weigh the pot as part of the analysis. And Sophie will explain a little bit more about this and why we do this later. And secondly, the plastic has been tested to ensure that it doesn't affect the sperm in the sample, so it's been approved for use. So if the sample is produced into a non-approved pot, it may be that we'll have to repeat the sample as we won't be able to get an accurate result for some of the parameters. So as I mentioned, this is the request form that's given in the referral pack. There's a few different parts to go through for it. So the first section here is the information to be completed by the referrer or about the referrer if they haven't completed it, which is quite often the case. And we do quite often get people attending for an appointment where it hasn't been filled in and they're not sure who has referred them. all the results are sent directly to the referring clinician. So it's really important when attending that we know who has requested the analysis so that we can send the results to that clinician. Otherwise, it is possible that the results will be delayed. The second part of the form is then the essential information required for booking and producing the sample. And again, it's really important that these instructions are followed, otherwise it might lead to samples being rejected or having to be repeated again. And this is to ensure that we're getting an accurate representation of the quality of the sample. So some of the information included in this would be abstaining from ejaculation for 2 to 7 days prior to producing the sample for analysis, collecting the sample by masturbation, collecting the whole sample, keeping the sample at room temperature and avoiding extremes of temperature, ensuring the sample is delivered to the lab within 50 minutes of production, and avoiding strong smelling deodorants or perfumes on the day of the sample is going to be produced. So there's a lot of information on there that would need to be read before booking or to book your appointment, and then it's ideal really to read it again on the day that you're producing your sample as well, just to make sure that you are following everything. The next section then is to be completed at the time of the appointment. Some bits like your personal information can be completed in advance because we know what they are, they're not going to change. Others will need to be completed at the time of the appointment, for example, the time of production or whether the entire sample was collected. And then the final section here is the part that we use in the lab, so that's where we will record all of your results. Then we go on to booking an appointment. So we book appointments on our website, and you book those for yourselves at the time that is convenient to you, rather than it being allocated. So to do that, if we go back to the referral form, there's a QR code here. And if you scan the QR code, that will take you to our website, which will then lead you into our booking system. So on the website, if you click on the SBU Andrology here, that will then direct you to our booking system over here, which is then broken down into the different appointment types. So they're split between the two sites, Cardiff and Singleton. You can select whichever one is more appropriate for you. And then we have 2 different appointment types, so the dropping off or the production room. So drop off should only be selected if the sample can be delivered to us within 50 minutes, because that will ensure that the sample hasn't been compromised. Once a service is selected, the available appointments will show on the calendar below. And the appointment system works on a 6-week rolling period. So tonight appointments will be released for 6 weeks tomorrow, and on Tuesday night appointments will be released for 6 weeks on Wednesday. So it's a constant release of appointments. It's not done in blocks. And at the moment we are experiencing very high demand, so the appointment availability can be limited. We are aware of this and we are trying ways to try and improve that availability. So one of the things we've recently done is to introduce a text messaging service as reminders for appointments. So we're hoping to see that in the next couple of weeks, we'll see improved appointment availability. So we're keeping an eye on that. So then the next thing is what to expect when you're attending. And there's a couple of major things here, which we are very aware of. And we know that it affects visitors to the hospital, whether it's patients or people visiting, regardless. The first one is car parking, and this is relevant to both sites, but it is particularly to Cardiff at UHW. Parking can be very problematic, and we frequently get phone calls from patients in the car park saying that their appointment is now, but they can't find a space. And it does happen quite a lot, and we know how congested it does get out there. So we'd absolutely recommend using the park and ride from Pentwyn. It takes 6 minutes to get to the hospital on the bus, and it goes every 20 minutes. So it is quite a frequent service, and it is far less stressful than trying to find a parking space. The second thing is to try and find us when you get onto the hospital site. So again, for both sites, this is significant, but in particular UHW, which is an absolute maze. The hospital site is enormous, and you're looking for the very nondescript door that you can see at the bottom of the slide. So we are quite well hidden, so it can be quite difficult to find us. Again, we're trying to do what we can to help with this. So we've recently produced some very detailed directions, which we're hoping will be on our website in the next week or so. And this should make it much easier to find us. And we're also looking at how to make the entrance to the department a little bit less inconspicuous, because we know a lot of people do just walk past the door without seeing us because it is so well hidden. So then As we've mentioned previously, there are two types of appointment, drop-off and production room. So when you get to us, drop-off samples are delivered by the service user or their partner, and the samples can be brought from home. The sample must not be produced in a public toilet or a car or anywhere public, as this is illegal under the Sexual Offences Act 2003. And then the other appointments are production room appointments, and samples are produced in a dedicated sample production room on site. Again, we get feedback that these rooms are quite clinical and they're not the easiest place to produce a sample. However, it does give the opportunity for where patients live more than 50 minutes away for them to get the samples to us, to ensure that we get a sample that can be assessed within the required time frame. And again, we're looking at ways to try and improve these rooms. So if anybody has used our production rooms or has any suggestions, we're always grateful to receive that feedback to help improve them. Once the sample has been produced by either the production room or the drop-off appointment, the form is checked for completion with a member of the team. We'll go through any questions that you might have, and then the results will be available with the referring clinician 2 weeks later. And I will pass you over to Sophie, who will go through the diagnostic semen analysis.
Hi, so a diagnostic semen analysis is a basic test of male fertility. It highlights whether male factor is contributing to a couple's infertility, and it can also demonstrate whether the service user can produce a sample on request or whether there needs to be storage of a backup sample that might need to be considered for treatment in the future. So there's two parts to the diagnostic semen analysis. So there's a macroscopic assessment and a microscopic assessment, which I'll talk through individually now. So the first thing that we look at is appearance. The sample appearance is affected by the composition of the semen. So we look at kind of the opacity of the sample, which can be dependent on the sperm concentration. So a lower concentration, the sample can appear more transparent, and a higher concentration may result in the sample appearing cloudier. We also look at the colour, and the colour of the sample can vary. So generally, the sample is clear or white or grey, but it can also be red or brown or yellow. And there may also be the presence of other solids in the sample, so mucus grains or crystals in the sample as well. So then the next thing that we look at is the pH, and the pH of the sample is important because it can affect sperm motility. So the WHO reference value, the lower reference limit of pH is 7.2, and low and high pHs can indicate various things. So a low pH can be an indicator of a duct obstruction or congenital absence of the vas deferens, and a high pH can be an indicator of possible infection, which could lead to decreased prostatic secretions. So the next thing that we look at is the volume of the sample. So the lower reference limit for this is 1.4 mil, and we measure this parameter by weight, because measuring directly by volume could result in inaccuracies due to viscosity of the sample. This kind of feeds into why the sample needs to be collected into one of the pots that are distributed by ourselves. So the pots are pre-weighed so we can accurately measure the volume of the sample. And the volume can indicate various things as well. So a high volume could be a result of accessory gland infections or prostatitis, and a low volume could be a result of multiple things. So it could just be failure to collect the whole sample, could be a result of a reduced absence, so less than 48 hours, gland malfunction, a clinical disorder, or it could also be retrograde ejaculation. So then we go on to the microscopic analysis. So the first thing that we look at is agglutination and aggregation of sperm. So this is when the sperm bind together. Agglutination refers to motile sperm sticking together, so it could be head to head, tail to tail, or mixed. But it's when the motile sperm are bound, and then aggregation is adherence of the motile sperm to one another. So this sperm clumping can prevent the sperm from swimming freely to fertilise the egg, which is why it needs to be kind of measured. So then the next thing we look at is motility. So sperm motility is categorised by, well, it's A, B, C, D, where A correlates to fast progressively motile, B is slow progressively motile, C is non-progressive motility, and D is a motile. And you can see video of the sperm at the bottom. So the WHO lower reference limits for total motility is 41%, so that includes A, B and C, and progressive motility, which is 29%, which is just A and B. Motility is affected by pH and temperature, which is why it's really important to adhere to the instructions that we provide on our referral form, which kind of outlines the need to maintain the sample temperature. So then we go on to analyse vitality. So vitality isn't analysed on all samples, so it might not be on all reports. It's just necessary when less than 40% of the sperm are motile. So the reference limit for this is 53%, but vitality discriminates between immotile dead sperm and immotile live sperm. So live but immotile sperm could be indicative of a structural defect in kind of the tail of the sperm, and just immotile dead sperm cells could indicate epididymal pathology or an immunological reaction to infection. Vitality is estimated by assessing the membrane integrity of the sperm cells. So we use eosin nicotine stain. So samples that are sperm that are dead, they don't have an intact sperm membrane, so the dye will kind of seep into the sperm and they appear pink. And live sperm do have an intact cell membrane, so they appear white. Then we go on to anti-sperm antibodies. This is kind of, it goes hand in hand with agglutination. So agglutination can suggest that there are anti-sperm antibodies present, not always, but it can do. And the presence of these can suggest that there may be some kind of impairment in sperm transit through cervical. Because sperm production doesn't start until puberty, sperm isn't recognised as part of the body. So any damage to the body testes barrier, such as some kind of trauma or an infection, could result in blood or sperm travelling across this barrier and producing an immune response, which could result in anti-sperm antibodies. So a sample is considered positive for anti-sperm antibodies when over 50% of motile sperm are bound to the latex fluid, which is what you could see in that video. And so the next parameter we look at is concentration. So concentration is the number of sperm within the sample. So the WHO reference limits are 15.9 million sperm per ml of ejaculate and 38.9 million sperm per ejaculate as a whole. So this is calculated from volume as well, the 38.9 million sperm per ejaculate, which is why it's really important, again, to use our pot, because they've been 3 ways. We can get an accurate volume and to collect the whole sample, or inform us if the whole sample isn't collected. So the morphology of the sperm is analysed, and this is the appearance of the sperm. So it's their shape and their size, and it's a useful parameter in assessing male fertility. So the majority of sperm have an abnormal morphology, which you can see just by the WHO reference limit as being 3% as well. And so we'll have a look at a picture of them now. So the first thing we look at in terms of sperm morphology is the sperm head. So the easiest one to see on this image is labelled 15. So you can see at the bottom of the sperm head, it's kind of missing a little bit. It's not perfectly round. It's not symmetrical. So automatically from the get-go, that would be abnormal because the head's not a normal shape. And that's the same for 20, 21 and 22 as well. The next thing that we look at is the tail and the morphology of that. And there's actually not any the tails are morphologically abnormal in this image, but you'd be looking for whether the tail was crooked and like bent, or whether it was double-tailed or something like that. And then the next thing that we look at after that is the midpiece. So that's the region between the head and the tail. So you can see for 19 has a relatively normal shaped head, and the tail looks fine, but the midpiece, so the part in the middle, is thicker in comparison to the rest. So that would be morphologically abnormal too. So the normal ones on this slide would be 17 and 18. And then the next thing that we look at is other cells within the sample. So the final microscopic analysis is measuring and calculating any other cells present. So it could be immature sperm cells, it could be epithelial cells, so like skin cells, or leukocytes, which are white blood cells, which could indicate some form of infection. But it is normal to have some white blood cells within the ejacula anyway. And then finally, we look at retrograde semen analysis. So the key symptoms of retrograde ejaculation are the absence of sperm, a low semen volume or absent ejaculate at all, so none at all, cloudy urine post ejaculation, and a high pH. So this can be caused by multiple things, so diabetes, MS, surgery on the neck of the bladder, or different medications. And this can result in problems with the neck of the bladder where it doesn't close properly, so it results in semen going backwards into the bladder rather than out as normal. So the next slide, sorry. So next steps are the results would go back to the referring clinician. So it depends who's referred you to begin with. So if you've been referred by your GP, the GP then may refer you to secondary care, so gynecology or urology. If you've been referred by secondary care already, then they may refer you to ourselves. And if it's a request from WFI, then these results would be reviewed by a clinician as part of the treatment plan. That's it. Thank you.
Oh, both, thank you so much. That was so interesting. I think for all of us going through treatment, access to information from professionals can really break down barriers. And I think it breaks down the unknowns as well. And it can make what sometimes feel like an overwhelming process a lot easier. And I do hope this webinar does that for those using the service at Wales Fertility Institute in the future. So thank you. And we've got a couple of questions. So if it's okay, I'll go with the first one. And that is, you mentioned some meds causing retrograde in the semen analysis. What are these?
Sorry, could you repeat it again? Sorry, I missed the first bit, sorry.
That's okay. You mentioned some medications causing retrograde in the semen analysis. What are these? So what are the meds that might cause that?
I'll be honest, off the top of my head, that is things that we wouldn't necessarily come through from us. It would be things that patients would get referred to for. It would be things that would affect the muscles around the neck of the bladder. But specific medications is not something that I would be able to answer. I'm not sure whether Sophie would be able to.
Not off the top of my head, I'm really sorry.
I think if you look at you can find information online, but it tends to be things about conditions rather than, there are medications that do it, but it would be the prescribing clinician that would have that information more than we would for individual medications.
So okay, thank you. The next question, I'm a trans woman, hopefully about to start fertility preservation. I'm really nervous about doing my sample. Is there a way to do it, not to do it naturally, so to speak, maybe surgical extraction?
So there is the option of surgical sperm retrieval. It is a more complex pathway to take. It will be a much slower and much longer pathway. And there would be certain steps that would have to be fulfilled in order for it to be funded that way on the NHS. So primarily we will do everything we can to try and make the production of a sample as easy as it can be that coming in to see what the unit is like, to have a look around, rather than just coming straight in to produce a sample on the first appointment. So coming in, having a look, having a chat with us, having discussions with us over anything that we can do to help. We can look at producing samples from home. That's a discussion that we can have as well. So it's not necessarily it's got to be this coming in to produce a sample from the off, and it's all got to be done on one appointment, or surgical sperm retrieval. there is different things that we can look at and have discussions along the way to try and because everybody's different, not everybody wants to come in and just get it done in one appointment. Some people would like to come and have a to see what it's visualizing everything. I think for some people helps an awful lot, and knowing the people that you're going to come and see. So by all means, if that is what will help you, then absolutely have a chat with us, and we can arrange appointments to come in and do it in a stepwise fashion to make it as easy as it can possibly be.
Thank you, Sarah. I think sort of your mention of seeing the room, and that goes back to my earlier comment about breaking down the barriers and the unknown. So thank you. That's actually the end of our questions. You've obviously covered practically everything. So thank you once again. Thank you both Sarah and Sophie from Wales Fertility Institute. We really appreciate it. Good night, everyone.
Thank you.
Thank you.